Hi, my name's Paul Prevjensky. In this video, I'm going to give you an introduction to business cases for health service managers, and you will probably see a flavour of health service management in New South Wales in here. So what am I going to cover? The why do you need a business case, the basics of how to make a business case, understanding the business process in health and in this context, understanding your audience, which is probably the biggest part of your business case, then building the business case, clarifying the need, building the team, considering alternatives, and thinking through the how at a pretty high level. There's always the financial aspects, the costs and benefits, the accounting for risks, the calculating the return on investment, and then there's a checklist. And I'll give you an example of a business case structure which is used in health service currently. So it's important to note here that I use the Harvard Business Review Guide to Building Business Cases. I draw from the guidelines from the New South Wales Treasury and the Audit Office of New South Wales. Each of these elements is flavoured with my own experience in healthcare. So let's begin. Why do you need a business case? Really, the big things that business cases are most often sought for are pitching for a new service. In health, that may look like a new operating theatre, an additional consultant, a new nursing position, a new outpatients clinic, seeking funds for a startup service or equipment, and the purchase or replacement of high-cost capital equipment. But basically, a business case, whether it's in the large scale or even in the small scale to buy a ECG machine, it's helping people decide whether to invest the resources they have at hand in your idea. So the basics for the business case. Start with a problem. It sounds a little bit negative, but if you have a problem or a business need you're trying to solve, you're identifying an opportunity. Identify who the key stakeholders are, identify the beneficiaries, who those patients are, how many of them there are, identify the subject matter experts that you'll draw from this case. So there's many people who work in clinics, there's many people who work in hospitals, but who are the experts in this particular field that you will need to draw upon regularly for this case development? So in health, you want to ask first, what is the local process for your organisation? Do you have a template for business case development? Do you have a person with business development skills who you will use? Do stakeholders look at projects individually or as a group? So, is there an executive committee? Is there a business development committee? Is there an individual that will always be the person who signs off? What level of detail do you require? Do you require a 2-page summary for this, or do you require a 50-page document that has got external accounting review? Is your business case approved all at once, or is it approved in phases? Who has the delegation for approvals of your project? Have a look in your delegation manual. Is it at your CEO's level of approval? Is it your Director of Nursing's level of approval? Find out who you're doing the case for. Understand who your audience is. Who calls the shots in your place? Is it the CEO who makes all the decisions? Does the clinical director have to have sign-off on everything? Is the CFO or the Director of Finance have the final word on every business case? Secondly, who has influence? Who are the informal clinical leaders that will influence the need? And who will have your back? Find the champion for the review committee. So the more important thing in doing a business case is understanding your audience. What are your organisation's strategic objectives? What are your leaders looking for to meet those objectives? Now, go to your annual report, go to your website, look at what are the vision, the values, the mission of your organisation. Find your operational plan. That will tell you what your organisation and your leaders are needing to achieve for the community, for the funder, for the shareholder, for the minister. Understand who else is competing for the limited resources. So you may be proposing a cardiac service. Is there a gastroenterology service that is also competing for those resources? Do you need to collaborate? Do you need to compete? Gather this intelligence from your cross-functional reference group and from your leaders. This is about, in health, all people all professions. So gather the intelligence. Examine the stakeholders' record on what they have approved. So what has been approved recently? When are those business cases approved? And what's the value of them? So, right, you've understood your context. You've got a bit of an understanding of your stakeholders. Now it's down to the business case. What is the need? Are you trying to solve a problem? Or have you been presented with an opportunity that will benefit the customers or the patients in your service? Talk to the beneficiaries. When did this problem first occur for them? How does this manifest? What does it look like? Get a patient story. Get a real feel for what the problem is. How does the problem prevent the teams from doing their work? Who else in the organisation will it affect? Are there people who are looking for that space? Are there people who are looking for that dollar? It will adversely affect as well. Gather the relevant data, reports and surveys that the beneficiaries can provide you. Look a little bit broader to your external environment. Quite often, someone out there, an interest group or a patient group, has done some background, has done some surveying, or even commissioned a report that will inform your case. Analyse the process. Look at the process that you are trying to change. Create a chart that analyses the process from a patient's perspective from where to go. The example I'm showing here is about the key steps in the ambulance turnaround time, which I thought was a great, simple flowchart that can help you focus on what it is that you are trying to change for your patients. Building the business case. Agree on what the solution should accomplish. That means with your cross-functional reference group, where will your solution be used? How will it be used? Who will be affected by it, both internally and externally? How should we measure the effectiveness? That is crucial. Does it make a difference? Does it make a difference to the person that is going to receive the solution? Should we combine the solution with another related initiative? Is there a solution that doesn't just meet our cardiac example, that may need a general population approach to providing care, such as a cardiac clinic that has run out of a primary care environment? But one of the things that I've always learned, whenever you do this investigation, whenever you do a consult with your cross-specialty reference group, always document. Build the cross-functional team. Bring the people together, as I've already mentioned, from different departments and different points in the process. Always have a finance representative. You will always need it for the costings. Always have several beneficiaries. The people who are going to benefit from this are going to be best able to give you the insight to document that you need. Someone who regularly talks with the consumers and customers is absolutely crucial, and an external expert. So if you have someone that's done this before in a different service or in a different healthcare environment, get them in on your process. Consider alternatives to the proposal that you originally came up with. You need to get your team together, forego some precision about what you are trying to do, push beyond the obvious to try and come up with alternatives. Techniques to broaden your perspectives and to help you think differently might be start with the desired end state and then work backwards to how you might achieve the improvement or the business case. Think about how other departments would address the issue. The way that you do it in your specialty may not be the same as you do it in a surgical or a medical specialty. Try and think about how they would do it and look for those people who have been successful. Consider how you do the project with different constraints. How would you do it if you had no money? How would you do it if you had no buildings? How would you do it if you had no workforce available? Always put into your business case the do nothing option and do a costs and benefits for the do nothing as well. And then once you've got several alternatives, start to narrow down through the use of advantages and disadvantages listing to what your best option is. The thing that you will need to put in your business case is how you're going to do this. How are you going to put this in place? So think through at a high level. How would the organisation implement the solution you are proposing? This is not a detailed proposal, not a low-level detailed project plan at this point. Consult the subject matter expert team. They will be able to tell you how you run one of these services or build one of these pieces of equipment or build one of these hospitals, and make a plan that is directionally correct. That is giving it a high-level direction, not a low-level. The important part of estimating the costs and benefits. You will need your organisations or divisions or departments or cost centres profit and loss statements. Your costs and benefits will make up the cash flow for your project. When I say cash flow, when the money goes out, at what time does it go out, and at what time does it come back in? You will need to show the stream of expenses over time and income over time for each year until the benefits will run out, meaning either the income ceases or the equipment is no longer usable or the patients are no longer requiring the treatment. Costs are project costs and operating costs. So that means that the costs are what it takes in training to get people up to speed on the new processes or how to use the new equipment, but also what it takes in terms of staff or fuel, light and power to run the service. The benefits are the revenue that will bring in or productivity savings. So you may have a benefit of an income from a paying customer, or you may have a benefit of a reduced expense because of a lower number of admissions. Intangible costs and benefits. These are the things that we talk about for a patient that may not, or for a staff member, that may not have a measurement that you can put a dollar against. Things are hard to measure, like patient satisfaction or staff satisfaction. Track each number and where it comes from. Make sure you document that. Manage any uncertainty. So if there is uncertainty on how you come up with a productivity saving, list all of the assumptions and make a case that your measurement of benefits is as good as it possibly can. Ignore any sunk costs. If you've already invested that money before you started this business case to create or establish this service, it should not be included in this business case. Calculate the return on your investment. The return on investment is the benefit, meaning the whole benefit, divided by the total costs. A positive return on investment is good. What I've got on the screen here is just a really simple picture of a project investment, and it shows at the top the capital expense required, the project expense required, the ongoing costs, the operating expense for staff, fuel, light and power or maintenance, and then the benefits down below. What the return on investment is, what the income is, what the productivity savings are over a 10-year period. It's important to note that the return on investments is a static measure. There are many measures, much more advanced and dynamic at looking at how you get a return on investment. These things are break-even analysis, payback period, net present value, or internal rate of return. In doing a higher value, you will probably be using a net present value or an internal rate of return. Which one you used is best determined by your project type and what is important to your service. These are the ones listed here. You've got to account for the risks in your project. You've got to gut check the numbers. You'll always be challenged on the benefits. You'll always be challenged on the costs. Just make it sure that they look right and that you've got a good assumptions about how you came up with these costs and benefits. Go through your estimates line by line and consider what factors might alter them. Rate each risk against their probability and impact. Factor those risks into your cost and benefit spreadsheets. Do a checklist to see if you're ready to present your business case. Have you got everything down? This is the one that you should go through. I think this is really good. Again, this is from the Harvard Business Review Guide to your business case. What I have here on the screen is a basic set of headers for a business case that I've done before and is used by several organisations across Australia. I hope you found this useful. If you are a student of this, you may want to have a look at these couple of questions that might help you refine what are the really important parts of building a business case. Thanks very much for listening. I hope you enjoyed the video. Any questions, please let me know.